The technology is there and people will use it. Some of the sad cases I've seen, having worked in general practice background, is when people use websites and then they've ended up being sold products that might necessarily be useful for their condition and things like that, or they've got a lot of information which can be inaccurate and even quite frightening. But, you know, people will use websites to find information. But, for example, the NHS Choices website is an extremely comprehensive website which gives you information on drugs, on health, on conditions. Absolutely anything that you can think of is covered on that website, and it's safe and you're not going to be duped into spending money and things. So, you know, that's the information we always give. Yes, websites can be really good, but you need to know which ones to avoid. It's the convenience, isn't it? You know, you can do it at night, you can do it whenever, you can do it in work. The convenience. The use of technology in that way is really helpful if you've got something that's not bad enough to take, you know, to take time off work, or, you know, you can still get around and things. Then, you know, come back to the pharmacy, the walk-in centres, you know, practices that have practice nurses, you can get advice and things with those as well. So, you know, ultimately, if it's something that's more serious or it's lasting longer, then obviously you have to see your GP. But, you know, it's a combination of the a good website plus that advice, you know, if you need further verification for that. The commonest thing we see is where people have really got very upset and very worried, haven't slept, you know, because they've been misled or they've misconstrued something, you know, because it is a complicated area.